Hi, and welcome to Steps to Strides with me, Connor Ratcliffe, and we're back in the garage gym today looking at some potential loading strategies for our tibialis posterior. Today's exercise is a single limb tiptoe raise for tibialis posterior, which means we're looking at a modified or adapted version of a tiptoe raise to bias the load towards our tibialis posterior. Now, today's exercise, we're going to take balance out of the equation because we want this to be very specific to the movement to make sure that we're going to bias load to tibialis posterior, and balance is really going to make that quite challenging. So we're going to hang on to something when we do this. We're going to use our typical 1, 2, 3 second cue to make sure we're biasing the eccentric phase, and specifically when we're looking at tibialis posterior loading, that's quite important because it means it decelerates the kind of phase of contraction and type of contraction that we want, that's analogous to what goes on with tibialis posterior in gait. So when we look at the eccentric contraction, that's decelerating pronation or eversion, which is usually the bit that we're concerned about with tibialis posterior. The concentric bit is when we start to resupinate throughout gait, ready for rigid lever propulsion. So we're going to hang on to something, come up for 1, hold for 2, down for 3, nice and slowly, with our 1, 2, 3 second tempo that you'll see I use a lot in a lot of videos. It's easy to remember, and it does typically what I want it to do, which is bias the eccentric phase of contraction. Now, the other thing that we're going to look at is our specific cue to modify this tiptoe raise to tibialis posterior, and that's going to be loading the fifth. So feeling the pressure under the little toe, feeling the pressure under this area. We can even use kinesthetic cues and sort of push there and push there when the patient's weight bearing to make sure they're feeling it where we want them to. Now, we do have to be a little bit mindful that this is going to put quite a lot of pressure in that area, so make sure we're doing this on a nice soft mat or plush carpet, or you can do it in cushioned trainers, but if you've got a big drop or offset in the trainers, then that's going to limit the sagittal plane range of motion, which you may or may not be bothered about, but be aware it will modify the exercise, typically making it a little bit easier in the sagittal plane because there's less range of motion then. So we're going to hang on and we'll have a look at this. We'll engage our cues and then we'll have a look at it from behind so we can see the difference that makes in calcaneal position and the difference it makes in the frontal plane activation, which is the tibialis posterior bit in this modified tiptoe raise. So it takes it from just being a sagittal plane dominant exercise is the idea. So we get more engagement of the inverters and tibialis posterior specifically going through plantar flexion inversion. So we're going to come up, feel the pressure under the little toe, pressure under the ball of the foot on the outside or in this area. And then we're going to come down nice and slowly for a count of 3. Up for 1, hold for 2, pressure under little toe, down for a count of 3. Now if we turn around and have a look at this, you should be able to see the difference that this makes in my calcaneal position. So if I do this unbiased, come up into that position, if I feel the pressure under my little toe, then it forces that calcaneal inversion. Down for 3, nice and slowly. And you can see that eccentric control where it takes us from a nice inverted position into deceleration of eversion and a less inverted position at our end range. Pressure under little toe, that's engaging our cue, and down nice and slowly. Now the nice thing with these weight bearing exercises is that they have inbuilt progression really, as long as you've got the equipment to do so. So you can put a backpack on and you can add external load. You can increase range of motion by popping a towel under the forefoot and then incrementally increasing reps. But let's have a look at adding external weight with the dumbbell. Now in some of my other videos, you'll see that I use a wrist strap for this, and that's because I don't want my grip to be the limiting factor, and I want to make sure I'm adding enough external load to fatigue my target structure. So let's take a look at it. So we've got our external load with our dumbbell in this case, and we're just going to rinse and repeat. So we're going to come up for 1, hold for 2, down for a count of 3, feeling the pressure under my little toe, nice and slow. Down nice and slow. So it's an easy way for us to just modify intensity without having to change exercise. And to make sure that we're getting adequate load and fatigue in our structure as we need to make sure we're falling within a therapeutic range. Now, single limb modified tiptoe raise with external load is typically my preference, just because when we do this with double limb, one, it makes balance a little bit trickier. It's easier because we're in a double limb support, but you've got no free hand to hold on to anything. And in these modified exercises, it can still make you unstable. The other downside with double limb is that potentially you'll get unintentional weight shift, especially if you've got unilateral symptoms or one side's weaker than another. When you're doing this, you might find you bias to one side, typically the asymptomatic side or the stronger side, and that can be quite subtle and hard to pick up on. So a single limb can be a little bit more advantageous in that respect. The benefit of double limb is that it's quicker because you can do both together, but usually once I start adding external load, and even without external load where possible, that's always my progression. I like to get to single limb so we can isolate that side rather than having potential compensations that are hard to spot. So that's today's exercise. That's a single limb tiptoe raise for tibialis posterior.